Hi everyone, welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance, the acupuncturist. Now, our topic today is about how is stable angina treated by medication and surgery. Now, we cover acupuncture strategy for stable angina treatment, as well as the best diet yesterday and acupressure point. But now today our topic is gonna be what about medication and surgery for stable angina, which you probably heard a lot. You have a patient or you have friends or family or medication and suffer from angina. It suffer from angina when they had an episode. What do they do? We're gonna discuss this and what further things that you may heard a lot of people have surgery for it. And what does a surgery really do? All right, we're gonna talk about this today. First, let me go into my. I'm just trying to share on my Facebook. So if you're here, please give me a thumbs up and say hi to me. So this is important. And further on, please share this video. Share this video. I'm putting on Facebook and watch the video at the moment. Watch party, that's what we say. Okay, then I'm going to Instagram. So I have Instagram as well. I'm going to share this on turn it to Instagram platform and do a live video on Instagram as well. Right. Okay. Now, if you are watching the replay, right, please, you might want to fast forward to 2 or 3 minutes. Then you're able to start with. We're gonna begin the topic every time in about 2 or 3 minutes, or even 5 minutes. Right? Okay, cool. Let's start the topic today. Hi Veronica, how are you? Nice to meet you. I'm very good, thank you. And hi Eric, how are you? Okay, my YouTube just gone on. Hi Happy Day, how are you? Hi Shansa Chains Acupuncture. How are you? Thank you for joining us. Thank you. So again, our topic today is about how is stable angina treated with medication and surgery. Wow. So first thing first. Now, for angina, we know the cause, right? We've been discussing the cause, and every time we talk about the symptoms, we talk about acupuncture and acupressure point, and we talk about best diet, and we always link back to the cause. And the cause is because the heart muscle wouldn't get enough oxygen and blood flow into it, and the reason is because the artery narrowing. Right? The narrowing artery is an issue. It is that because of that prevent the blood flowing to the heart muscle and support heart oxygen. Now, which means, and so that maybe if that is the plaque that happening, and the plaque is actually come from high cholesterol, then this patient or you may own high cholesterol pill, right? And think about it. The plaque formed in the artery, in the wall of artery, then that is from cholesterol, so you need to take cholesterol pill. And when the plaque forms, it causes another symptom called high blood pressure. Then most likely, most of the case, you are on high blood pressure pill. That's another pill. That's very common though. Those are very common. Right. Further on, if the angina is come from the clots, or even though they're not sure where it comes from, they will give you a blood thinner. So blood thinner, because blood clots is another cause for angina. So to prevent the blood clots produced in your body, so your doctor most likely to give you a blood thinner. Okay, so those are the medication that for long-term use for angina patient. Very commonly, very commonly. Okay, so I'll let you know here what is a common medication for angina. But what about when you have an episode? We talk about the stable angina is when you have it happen when you exercise, when you have emotional issues, when you're angry, and you get an episode. Oh, it's very painful. In general, then you may not feel any pain at all. Okay, and all. So that means that at that time you need a lot of blood flow and oxygen to your heart, and your heart is working quite hard. It needs more oxygen than usual, and your body wouldn't be able to provide it to your heart. Then you start to experience pain in your chest, and that's important. So you might pass away. You might pass down because of that. And may faint. May need to go to emergency, right? But there is a medication which is very useful. It's called nitroglycerin, which is put under your tongue. When that happens, just put one pill under your tongue, and it will quickly resolve the pain, and that's very helpful. So if you suffer from angina, this is the only pill that you actually take it with you whenever you go out. Right. So this is important. If you have angina, the pill of nitroglycerin is the most common and important pill that can relieve. It's very effective one and relieve pain associated with the stable angina. Okay. Now the doses, that how much you need to take in, your doctor will let you know. Okay. And so the underlying conditions that contribute to stable angina, which we just mentioned about it: high blood pressure, high cholesterol, and diabetes. So if you have those conditions, then you are going to take some medication, long-term medication. But think about it. Yesterday we talked about the best diet for stable angina. Then why best diet? Because you see the high blood pressure, high cholesterol, high blood sugar. Those three things are directly caused from, directly linked to the diet. So changing diet, you sort those three issues. Then when these three issues gone, then enroll your risk to suffer angina. And this is very, very important. If you don't know about this, and we have patients, then we help them to lower the blood pressure, high cholesterol, blood sugar, and when those things are stable, we lower the medication for them. We help them to lower the medication. So this is very important. We're saving life, and we're not talking about replacing the organ function for the rest of your life. We are talking about restoring the organ function. So your organ, when your organs are balanced, and your organ will function itself, and those things will gone. And so you don't need medication. So the Western medicine, now they have an idea is try to control everything. We are not trying to control anything. We are trying to restore the organ function. This is the only way to treat all disease. This is the only way to treat high blood pressure, high cholesterol, diabetes, as well as stable angina. That's my opinion. Okay. This may not work. I mean the medication. Because the medication that you're taking it for long term, those are just trying to manage the symptoms, trying to control. It is not a permanent treatment that, oh, that's my daughter. Okay. That is not a treatment that can treat the diabetes or blood pressure or high cholesterol. Okay, it's just trying to control the symptom, the reading. Then eventually you're gonna end up with angina. If you have angina already and you have those things, and no one can fix it unless you change your diet and you do have the idea of you can cut down all the pill and you want to be better. Then we, Chinese medicine and acupuncture, will be able to help you. But again, not just Chinese medicine and acupuncture, you need to change your lifestyle. That's what we do in our clinic. Then further on, for most patients, right, when they suffer from angina, 1 or 2 times, they're probably okay. As they keep going, they're going to move to surgery. There's an invasive procedure called angioplasty. It is a surgery that's often used to treat stable angina. So during the procedure, okay, the surgeon places a small balloon inside your artery, and the balloon is inflated to widen the artery. So it blow, yeah. It go in and it blow, and then a stent. A stent is a tiny wire mesh coil. It will insert into the artery. So the stent is permanently placed in your artery to keep the passageway open. So it keep that open and keep your blood going. But again, this will be blocked again. It will block again eventually, because the stent is permanently placed in there, but it's only temporary fix. It's not a long-term fix, because if you're not changing your diet, changing your lifestyle, the cholesterol is still high, the clot still perform in your body, then eventually this valve close up again, blocked up again, and cause angina. Okay, blocked arteries may need to be surgically replaced to prevent chest pain. Open heart surgery may be done to perform a coronary artery bypass. So there's another bypass. If this is blocked, if they can't do the stent, they're gonna put another vein from here to the other side, connected from here to here. They call bypass. And they normally use your leg veins, one of the veins in your legs, and take it out and put it in your heart. That's what they do. That's what they do. Okay. Now, all this thing, you may prevent it. You may reverse it. And how do you do that? Surely, it's not from medication. It's not from your high blood pressure pill, high cholesterol pill, or diabetes pill. Okay. Be in mind, the diet will be able to reverse it. The diet not just preventing that happen, it can reverse it. This is important information. And again, when it comes to diet, the China study is the great book for you. Now, even though you have surgery, you're on medication, and changing diet is something that you must for stable angina. Okay, so plant-based diet is the best. Right? That's it for today, and we're going to see you tomorrow morning. Okay, we can't go to the temple on Sunday from now because Auckland, I normally go to Auckland, and Auckland is locked down for another 2 weeks. We're lucky at Hamilton, we're on level 2, so we'll be able to see patient and help patient. And if you need any help, please call us on 0784679956. Stay awesome, and I love you all. See you, bye-bye.